So let's talk a little bit about what to expect after breast surgery. This is a really important topic. Patients often ask, what will my healing process be like after breast surgery? So most patients that have breast surgery done have a very short window in terms of their downtime. Downtime and healing time are very different. The healing time is really how long it takes for things to be natural, almost to the point where you've forgotten that you've had surgery. Downtime is how long it takes before you're back at work. And I think that it's really important to understand those two different concepts. So after breast surgery, what your expectation should be is that immediately post-op, in the post-op area, I'll come out and talk to you and say you did great and show you some photos of what things look like on the table as an early expectation. Then the next day, you'll come back to the office where we'll take a look at how you're healing, change your dressings, see how things are healing on the inside and on the outside. At that point, we'll just be checking up on you to make sure that you're comfortable and that you've had a good night's rest and that you're prepared for the week ahead. At around 3 to 5 days, you'll be finishing up most of your medications. That's when many patients are able to go back to work. They're wearing a supportive bra, they've got a little bit of extra support going on, but most patients feel comfortable at that time point going back to doing most of the things they were doing before. At around 1 week, you come back to the office where we check up on you to make sure that you're healing well. This is an important time point because even though you feel much better from a physical standpoint, emotionally you're at your lowest point. It's because you're withdrawing from narcotic and anesthesia, but also from adrenaline and cortisol that your body formed during surgery. So that's when we take time to check in on you to make sure that you're doing okay with regards to your healing process, but also with regards to your emotional state. Around 10 days, that's when you start to feel much more natural. You come down off of that kind of early roller coaster of emotions, and you're starting to feel more comfortable in your own body. Around 2 weeks, you start to feel like your breasts are changing in a good way. The shape is changing to become more natural, the skin is softening, the breasts feel more natural to you. If you have implants, the implants are starting to drop and starting to feel more like a natural breast. Around 3 weeks is when things feel natural on the inside. You feel like your implants don't feel like a foreign body inside of you anymore. They feel much more like your breasts. Or if you've had other breast surgery, your sensation is coming back, so things feel more natural to you. Around 4 to 6 weeks, that's when all the incisions have healed on the outside. You may be ready to go back to the gym or ready to get back into the pool or go into the ocean. It's also a time point where we see you back in the office to make sure that things are dropping and moving in the way that they should. Things move at a different rate of speed, things change differently over time. No two breasts are the same before or after surgery. And so there's often areas where you may have questions for me about your breasts and how they're changing and how they're dropping. And that's an important time frame to check in and make sure that things are moving in the right direction and to change the process if we need to. Around 3 months is when you're ready for high definition photography or for a wedding. That's when patients are really feeling much better, and that's when they're sending me wine and flowers and more patients. Why? Because they look in the mirror and they love the results. That's a time when I'm also going to take a look and tell you, hey, we need to maybe inject the incision with a little bit of medication to help improve the appearance, or do a laser to improve the appearance of the scar that's there. It's also a time frame when more questions may come up and can be answered about the long-term questions that you're going to have about your breasts. I see you again around 6 months and around 1 year. It's not just simply surgery and see you later. It's an important process that occurs over time to check up on you to make sure that you're healing in the right direction and to potentially intervene and modulate your healing over time. So this is really what you should expect with regards to the journey of recovery and to the process of recovery after breast surgery.